kula Yesu.
And I decree the blessings of the Lord upon the entire congregation of repentance and holiness across all nations, even into Liberia and Ethiopia and Lilongwe, Malawi.
Na ninaamrisha na kutangaza baraka kuu za Bwana juu ya kusanyiko lote la Bwana katika huduma ya toba na utukufu kote kote kwenye mataifa yote, hata kule Liberia, Lilongwe, Malawi, hata Ethiopia.
And I bless all the sheep of Christ in this congregation.
Na ninabariki kondoo wote wa Kristo katika kusanyiko hili.
You have seen very clearly that the Lord is asking you to redefine your Christian salvation.
Mmeona wazi kabisa kwamba Bwana anawauliza mkaweze kuangalia tena wokovu wenu wa Kikristo.
And sharpen your salvation.
Na kutia makali wokovu wenu.
Because time is over.
Kwa sababu wakati umekwisha.
And so right now,
kwa hivyo sasa hivi,
let us go straight to India before we finish tonight's session.
Wacha tuende moja kwa moja kwa India kabla tumalize awamu ya usiku wa leo.
Let Lusweti put I'm mentioning names live on air. So let us go to India right away. Thank you, blessed people.
Hivyo wacha tuende India moja kwa moja. Asanteni watu wabarikiwa.
Let us go to the prophecy, the words of my tongue.
Wacha tuende kwa unabii, maneno ya ulimi wangu.
But I bless you all.
Lakini mewabariki nyinyi wote.
The Messiah is coming.
Masiya yuwaja.
Be ready.
Iweni tayari.
The Lord has spoken to me again right now. The Lord took me into a hospital in Asia. There's a very big distress there. You see a lot of people swarming into the hospital. I see the lack of equipment. Now there's no equipment. The doctors are running up and down and many people flooding into the hospital. The Lord took me to Asia and I see a lot of people rushing into the hospital, being rushed. There's the procedure being done on somebody. And then there is testing. So somebody told me, well, he makes one of the doctors there to speak with me. And he says, we don't have equipment. What we do, we take this and they will take a little and put on the culture to see. So there is going to be a big distress that is going to come into Asia. A big disease, distress of disease is coming. There will be a disease emergency in Asia. That distress will be like none other. A distress that has not been seen. This kind of distress has shown me just a few minutes ago when it will develop on this earth, will throb on this planet earth, will throb on this planet earth. The Lord has spoken to me again right now. He took me to India. The Lord took me into a hospital in India. There's a very big distress there.
This is an ABC News.
But perhaps there is no nation on earth with a bigger crisis than India. They are on track to overtake the U.S. as the nation with the most cases worldwide.
Mohsin Khan used to speed through India's capital to save the living. Today, the medic races to collect the dead, weaving through Delhi's clogged streets, bodies swathed in white, ready for cremation, in a race to slow the spread of a disease coursing through India's veins. It now has the world's fastest growing rate of infection and death. Today, 2 more COVID-19 casualties are added to the more than 100,000 deaths. And more heartbroken families must mourn and grieve and bid farewell to their loved ones. This is what passes for an ordinary day as India gets hit by a second wave far more vicious than the first, preying on the most vulnerable. Today, Mohsin had to pick up the body of a 3-year-old girl.
My heart breaks. I have seen so many bodies.
It's beyond his remit. It's the grimmest of jobs, exacting a terrible toll. The bodies keep piling up. India seeing nearly 2.5 million new cases just this past month. We were in a New Delhi hospital this past June. Doctors in full PPE. Patients hooked up to ventilators.
These are the sickest of the lot.
The beeping in ICU wards, the soundtrack to a crisis steadily getting worse.
He's not waking up.
India's cases were starting to climb.
This situation is unlike anything which we have seen ever before. We are really struggling and we are trying that we can deliver our best. But yes, it's really tough.
The situation wearing on the doctors. Today, medical professionals in the country are sounding the alarm. India is now second only to the United States in having the most COVID cases, topping 5 million.
In most of the big cities, we are reaching a saturation point where most of the hospitals are choked to capacity. There is a scarcity.
Lord has spoken to me again right now. He took me to India. The Lord took me into a hospital in India. There's a very big distress there. The doctors are running up and down and many people flooding into the hospital.
Maharashtra, being the worst hit state in the country, has crossed the 1 lakh mark. And Mumbai, capital of Maharashtra, remains worst hit. 99% ICU beds are occupied. Government officials said hospitals have been instructed to strictly adhere to admission and discharge guidelines and only admit severely symptomatic patients to allow beds for critical patients.
India has become the second worst hit country by the coronavirus pandemic in the world. In total number of COVID-19 infections, the country has also recorded its highest COVID-19 cases in the last 24 hours. This is also the highest one-day surge recorded anywhere in the world. 90,800 people have been tested positive for the lethal virus in the last 24 hours. The death toll climbed to over 71,600 after more than 1,000 people lost their lives to COVID-19.
With a record 90,802 new confirmed cases Monday, India has now surpassed Brazil. It stands as the
As nurses are walking up and down past these corpses, the ward checking up on COVID patients.
A shocker from Mumbai. A video posted on Twitter by BJP MLA Nitesh Rane shows coronavirus patients in a hospital ward lying next to corpses wrapped in body bags. This horrifying clip is from Sion Hospital, which is run by the city's municipal corporation. At least 7 bodies are seen in the ward as patients are being treated in adjoining beds. Some patients have family members attending to them, apparently ignoring bodies right behind them.
Wards. Multiple patients sharing a single bed.
Of the LNJP mortuary is only 45 dead bodies at a time, but we are seeing that there were, in fact, in last 1 week there were more than 100 dead bodies that were at the mortuary, and because of which one after the other it was getting difficult for the LNJP mortuary, for the authorities to deal with the situation. Now we know that there was in fact a number of on one rack itself there were 2 bodies that were kept, and there were around 28 bodies that was thrown at the passage because there was no space at all to keep these bodies at the rack. There were few bodies that were around 80 of them were kept on the rack because there are around 40 racks are there. So in each rack, Swati, there were 2 dead bodies. Accordingly, there were 80 dead bodies that were kept there, and the other, the rest of them were in fact left on the passage.
In a disturbing video that emerged on Tuesday, 8 bodies of coronavirus victims were wrapped in plastic and dumped into a common pit in Karnataka's Ballari district. Officials, while maintaining that the bodies were wrapped in plastic as per rules, said that the inhumane treatment will be probed. Chief Minister B.S. Yediyurappa termed the behavior of the staff inhuman and painful.
The disturbing visuals that have gone viral on social media. You can see shots on our screens at the moment of a group of men in hazmat suits dumping body bags into a huge pit. What really is going on?
Well, the DC of Ballari, SS Nakul, has confirmed that this in fact was the burial of 8 people who had died of COVID-19. Now, of course, very distressing because many times family members cannot access the bodies of those who have died and cannot perform the funeral rites as per their wishes. But the DC confirming this was in fact disrespectful, as he put it, something he deeply regrets, the disrespectful handling of the bodies. This video has been widely shared actually, and of course it's given a chance to the opposition in the state. The Janata Dal Secular, the Congress's D.K. Shiv Kumar have tweeted criticizing the BJP government's handling of the entire COVID situation, using this as an example, in fact, The deeply distressing visuals, really. The remains of 8 people who died of COVID in Ballari district in Karnataka being tossed into a pit. The field team.
In a shocking case, a COVID victim has been abandoned outside a hospital in Bhopal on Monday night. It isn't clear from these visuals whether the patient was dead or alive at the time that he was abandoned. A Discom employee, he had been admitted with a kidney ailment. He then developed breathing trouble and was suspected to have pneumonia. He was diagnosed with corona on Monday evening. The hospital administration, it seems, was keen to shift him to a dedicated COVID facility. After he took a turn for the worse, the ambulance driver allegedly abandoned him outside the hospital on a pavement, a magisterial.
The Lord has spoken to me again right now. He took me to India. The Lord took me into a hospital in India. There's a very big distress there. The doctors are running up and down and many people are heading into the hospital.
A capital on its knees.
Consecutive day, India has set a global record for daily infections and deaths. But health experts believe the real numbers could be much higher.
There is no space. So a patient who needs an ICU comes to the casualty, right? What do I do?
For every 200 patients, only one doctor was available.
So many like her are putting in all they can.
So we are struggling.
He's desperately trying to get more oxygen.
यहाँ पे देख लीजिए, यहाँ पे 1 मीटर का 1 सेंटीमीटर भी नहीं है किसी के पास जगह।
पेशेंट यहाँ पे नीचे लेके लेटा हुआ है, कचरा वहाँ पे पड़ा हुआ है।
ये डेड बॉडी कल शाम से यहाँ।
बड़े भाई थे 38 साल के थे, रिकवर हो गए थे, ऑक्सीजन पे थे। मेरे सामने तड़प के ऑक्सीजन की मशीन बंद हो गई, कुछ नहीं आ रहा था, मेरे सामने तड़प के खत्म हुए। डॉक्टर चिल्लाते रह गए, कोई डॉक्टर नहीं आया, कोई डॉक्टर नहीं आया, कोई डॉक्टर नहीं आया, क्या मंदिर का इंटरव्यू लेने के लिए बैठे हैं।
The Lord has spoken to me again right now. He took me to India. The Lord took me into a hospital in distress there.
As India reports over 300,000 new cases of COVID-19 a day, hospitals are being forced to turn away the sick and dying.
This is a CBS News special report.
Critically ill COVID patients fade away while they wait, sometimes dying before they even reach the door.
Balaji!
The sister of Balaji Kurappa tried to keep him conscious, but in vain. A father of 2, he didn't make it. Ambulances arrive at the emergency doors only to be turned away because there are no beds, unless it's already too late. Inside, doctors and nurses triage patients, prioritizing the very sick and the even sicker. Currently, India accounts for nearly half the new COVID cases on Earth every day. The waiting room at the Guru Tegh Bahadur Public Hospital is a sea of desperation, crammed with people defying Delhi's strict lockdown to seek help.
A hospital in the western city of Bhavnagar. These are COVID patients and there are no doctors to look at them, says the man filming the video. In Pune, the worst affected.
Only one.
God has spoken to me again right now. He took me to India. The Lord took me into a hospital in India. There's a very big distress there. The doctors are running up and down and many people flooding into the hospital.
Man filming the video. In Pune, the worst affected city in India, people are being given oxygen outside a hospital because it's too full. Patients are struggling to get medical care as India is in the grips of a fierce second wave of COVID-19. Field hospitals built last year to add to existing facilities are already full.
As India struggles with a catastrophic second wave, heartbreaking scenes playing out outside hospitals in the national capital. The tragic human face of the COVID crisis visible in the folded hands, desperate cries for help, and the heart-wrenching screams when all is lost. 35-year-old Jyoti Chauhan died, waiting outside Gangaram Hospital's casualty ward. The family said they had been searching for a bed since 6 a.m. and they had to face rejection from 15 hospitals before the 35-year-old passed away. Meanwhile, another female patient with low oxygen passed away after she was brought to the GTP hospital. While the doctor tried to save her by giving her CPR and even an injection, all efforts failed. She had been denied admission by 4 other hospitals. Running short of beds, patients could be seen lying outside the emergency ward of the GTP hospital as well. With people pleading hospital staff to provide their loved ones with oxygen masks. India's healthcare system is under severe stress, with many prominent hospitals reporting severe shortage of oxygen and even beds. The situation looks grim, to say the least.
The Lord has spoken to me again right now. He took me to India. The Lord took me into a hospital in India. There's a very big distress there. The doctors are running up and down and many people flooding into the hospital.
A capital on its knees. Many of these people won't survive the night. Sir, for 1 minute, come and look at my mother. A man pleads. A doctor follows him to the ambulance and prepares to say the words he's had to say over and over again in the past day alone. She's no more. Her family, among hundreds in India, denied even the chance of saving a loved one. COVID-19 has hit this country with a ferocity not seen before.
We are definitely overburdened, rather double of the capacity.